this video, we are going to explore important tips and tricks to master OET Reading Part B. Are you struggling with Part B of the OET Reading test? You know that those short workplace text where you need to pick the right answer from three tricky options? Well, today I've got you covered. I'm going to break down powerful strategies to help you spot the right answers like a pro. So avoid those sneaky traps and think like the test makers. Okay? Now, before we jump into examples, I'm just going to give you a solid step by step approach to crack part B. Okay? First one is you have to read the question first. Before even looking at the text, you have to read the question because that gives you a clear purpose while reading. You have to ask yourself, what exactly am I looking for? Got it? And then comes skimming the text. So don't try to get lost in details. These texts are short. So quickly you can grasp the main idea and tone. Is it giving the instructions or explaining a policy or just warning about something else? Okay, you should try to identify within few minutes and then spot the keywords in options. The correct answer will be paraphrased in the text, but the wrong ones might use words from the text in a misleading way. You have to be very mindful about it. Okay? And the fourth one is try to find the evidence. Okay? So don't guess. The correct option must be 100% supported by the text. If it's kind of true, it's wrong, and then eliminate wrong answers. So you have to look for over generalization, extreme words usage such as always, never, or some answers that add extra information not in the text. Got it? So let's try to apply these tricks in examples. Are you ready? Let's go to an example text here. So the first one is about the memo to nurses. Here is the text. The hospital has revised its hand hygiene policy to enhance infection control. All staff must wash their hands using antimicrobial soap before and after patient contact. Additionally, hand sanitizers must be used when entering and leaving patient rooms. Compliance will be monitored and failure to follow protocol may result in a formal warning. Ensuring hand hygiene reduces the risk of cross contamination, safeguarding both patients and healthcare workers. The hospital administration urges strict adherence to these guidelines to maintain a safe environment for everyone. And here's the question. What is the main purpose of this memo? You have three options here: to inform staff about stricter hand hygiene policy, to warn staff about disciplinary actions, to encourage staff to improve patient care. Now, let me reveal the correct option. The right option is to inform staff about a stricter hand hygiene policy. So remember, you have to read the question carefully. This question is asking for the main purpose of the memo, right? And then you have to skim the text for the overall idea. So the memo focuses on new hygiene rules. And again, find the keywords, revised policy, which matches option A. And then verify the correct answer with evidence. So here the memo announces changes rather than focusing on punishment. So if you check for answer B, general patient care C, like these two answers, which is wrong. So you can easily eliminate those wrong options. Got it? Now let's move on to another example, email from HR. So dear staff, we are conducting a survey to assess job satisfaction levels within the hospital. Your feedback will help improve workplace conditions. The survey is anonymous and will take 5 minutes to complete. Please submit your responses by Friday. This initiative aims to identify areas of improvement and address staff concerns effectively. Your participation is highly valued and we encourage honest responses to help shape a better working environment. Good one. And the question is, what does the email mainly ask staff to do? And you have three options: attend a meeting on job satisfaction, provide suggestions for hospital improvement, share their feedback on work conditions. Now, again, step one, read the question first. It asks what staff are required to do. Got it? And the second one, skim the text. It talks about survey on job satisfaction if you skim the entire text, right? And third one, you have to look for the keywords survey, feedback, workplace conditions. If you check all these keywords, which one it matches? Of course, option C. The email mainly asks the staff to share their feedback on the work conditions, right? It is not asking to attend a meeting on job satisfaction, or it is not providing suggestions for hospital improvement. Got it? Now let's move on to another example. It's a safety alert notice. Attention all staff. Due to recent increase in reported needle stick injuries, we are implementing a new safety measures effective immediately. All used needles must be disposed of in designated sharps container. Staff must not recap needles after use, as this increases the risk of accidental injuries. Supervisors will conduct weekly audits to ensure compliance. Employees who fail to adhere to this policy may be subject to disciplinary action. These steps are critical to ensuring the safety of both staff and patients. If you have any questions, please contact the Infection Control Department. Now, the question here is, what is the main message of this notice? And you have three options: introduce disciplinary actions, implement stricter needle disposal, encourage reporting injuries. Okay, so remember our step by step approach. So, whatever text you are reading, okay, whatever short workplace extracts that you are reading, make sure to apply the four steps. Read the question first, skim the text, find keywords and options, verify the correct answer with evidence. Okay, and then finally you can eliminate the wrong options in order to confirm whether your answer is correct or not. Got it? So if you see the question, it asks for the main message, right? So you have to find the main message. Then comes skimming the text. So the notice focuses on needle disposal procedures. And if you want to find the keywords such as new safety measures, and it talks about the sharp containers and compliance, right? So obviously it matches with the option B, implement stricter needle disposal. Okay. And then, of course, the third one, we have done it. And fourth one, verify the correct answer with evidence. So here, the notice introduces a new disposal rules rather than just discussing disciplinary actions. So it is not introducing the disciplinary actions. It is implementing stricter needle disposal. Okay. And it is also not encouraging reporting injuries. Got it? And if you want to eliminate the wrong options, then you have to look for this disciplinary actions which are mentioned but not the main focus. And again, reporting injuries, this is not the central message, right? The question is about the main message of the notice, so which talks about the implementation of the stricter needle disposal. Got it? Now, that's all. You have just cracked part B with real exam style questions and detailed explanation. So remember to read the question first, look for keywords and paraphrasing, try to eliminate wrong answers with logic. So keep practicing and trust me, you will be nailing this section like a pro. If you found this helpful, drop a comment below and let me know which tip worked best for you. Okay? So don't forget to like, subscribe, and hit that notification bell so you never miss an OET power lesson. That's all for today's video. Bye bye.